The reason I say, you know, the road we've traveled, I mean, we have all traveled this together. I guess I'm mostly talking today about the road I've traveled, but I feel like we've all kind of been in this together. I'm currently in Washington, D.C., but for very many years I was practicing right here in Austin, Texas. I lived here for 34 years. And back in the 80s, I was very, very interested in chronic fatigue syndrome, CFIDS, which is chronic fatigue immune deficiency syndrome. And most of my patients had CFIDS. And I had gone to a conference in San Francisco in 1996 and met Dr. William Harvey there, and he was from Houston, Texas. So I stayed in very close touch with him. He was also treating chronic fatigue patients. And he actually is the one who first brought up to me that, you know what, these people actually have Lyme disease. And we started, you know, testing and treating these people, and it was like, oh my gosh, these people don't have this mysterious, nobody knows what it is illness. They actually have Lyme and or other tick-borne diseases. And so in 2003, I was doing primary care here in Austin, Texas. The skyline looks a little different now than it did then, much more busy skyline now. And a subset of my patients, my Lyme patients, came in with lesions like this. And raise your hand if you know whose legs these are. They're famous, they're infamous legs. Okay, it's gonna go down in history. But so anyway, you know, I would ask, of course, well, what's going on? Did you just scratch yourself too hard? Because it kind of reminded me of somebody who scratched their mosquito bites too hard. And people would say, no, these are just appearing like this spontaneously. And they would tell me about these filaments coming out of different colors. And so I found that to be very fascinating, you know, and so I would ask them more about their symptoms, and they told me a lot of other interesting symptoms that they all seem to share in common, like kind of a slimy or waxy film on their skin. Their teeth were kind of decomposing. Their hair had changed in texture. They had a lot of hair loss. Some of them had lost all their hair. All these little black specks on the skin and things that look like white seeds and gelatin on the skin. Inability to be around electronics, or they would seem to, like, electronic things would just stop when they'd be around them. And so it kind of sounded crazy at first. You know, I think most medical practitioners and even most everybody, when they first hear the symptoms, kind of think, well, you know, sounds pretty odd and unusual. But you know, the problem I have with most of my colleagues is they don't look, they don't stop and look. So I started really looking carefully with magnification, and I could see, you know, I could see all these filaments they were talking about with the different colors underneath the skin and coming out of the skin. I could see the black specks where, you know, there would be all over the palms, and you could brush them off, and then they would just, there they were again. And I was seeing this with my own eyes, and black liquid just all of a sudden coming out of the pores. I'd be talking to a person, all of a sudden they had a drop of black on their cheek, and their hair was just coming out, and then, you know, a lot of dental problems too. And so first of all, the reason I kind of really got drawn into it and realized, hey, this is a real thing, is just because of the similarity of all the stories, right? Because I had all these people coming in, they were telling me the exact same symptoms. I thought, well, what are the chances of that? It's got to be a real thing. And the media was claiming that this was a form of hysteria fueled by the internet, because they were saying people read about it and then they kind of know what symptoms to tell you, so they're just coming in and telling you what they read on the internet because they want to be counted as one of the cases, you know. And so, but you know, I was practicing in Texas, and a lot of the people that came to me were hardworking ranchers. They were hardly the type of people that would surf the internet all day and looking for a disease to have. They weren't really hypochondriacs. They were tough people. And they'd come in and they'd say, these weird symptoms are happening to me. And so Dr. Harvey in Houston and I compared notes. He'd been seeing the same thing in his Houston Lyme disease patients, you know, people coming in with these filaments. And I asked all my other Lyme, LLMD is a term we use for Lyme literate MD. And so my other colleagues, and none of them had any, you know, they weren't aware of it. They had not been seeing I remember that Dr. Stricker thought I was joking for the longest time. And, you know, and I kept telling my colleagues, look and pay attention, you know, with your Lyme patients, start looking at them. And so Dr. Harvey found out about Mary Leitao, and we started communicating with her. And most of you probably heard about her. She was a microbiology trained mother of 3 kids, and her 3-year-old son had started having scabs on his lip, and he complained of crawling sensation under the scab. And when she took the scab off and she looked under the microscope, she could see these unusual blue and red filaments that would fluoresce under kind of a woods light, like it was what you normally see in a fungus. But she was seeing this in these fibers. And so she started the original Morgellons Research Foundation. And the reason she called it Morgellons is because she had done some online research and found that back in the 1600s, somebody had written a textbook and given that name to it back then. It kind of, I assume it was Morgellons because it was in France. And this is a picture of the autofluorescence of the fibers from the skin lesion of her 3-year-old son. So she knew this was something unusual. She went out trying to find other doctors and researchers to believe her, but she ran into the same problems that all of you have. Couldn't get anybody to believe her, and it's a picture of her with her 3 children. Back in 2004, and I was treating a lot of Lyme patients, and I had this really interesting case of a ALS patient. I don't know if you all are familiar with ALS, but it's also known as Lou Gehrig's disease. And I had a patient who I then diagnosed with Lyme, who had previously been diagnosed with ALS, and he was getting better. And it was kind of like, wow, this is a miracle, you know. So they heard about it, and Jim Bergamo, who was a reporter, and I think he's still here in Austin. Maybe you guys know if some of you live here. He got interested in this story. He came out and he did a story on this guy. As he left my office, he said, wow, thanks for this, you know, great story. And I said, you think this is interesting? I said, I got a good one for you. And he said, what's that? And I said, you got to come back and I will teach you about Morgellons disease, and I'll show you those patients. That's going to be a fascinating story. And so we did that, and he did kind of a pretty long expose on it for the news. When that aired, opened the floodgates. The next day, we got calls in the office all day of people just saying, oh my gosh, I have all those symptoms. I've had them for years. I didn't know anyone else had them. I didn't know there was a name. I didn't know there was help or anything like that. And they were just so glad to know they were not alone, you know. And so they wanted me to help them. And it was like, oh my gosh, I didn't know what to do with all of these patients all of a sudden with Morgellons, because obviously I didn't know how to treat it. I wasn't even sure what was happening with them. But I figured, okay, it's happening in a subset of my Lyme patients, so heck, why not just test all these people for Lyme disease, you know, because maybe, you know, there's some relation there. So I did. I started testing them for Lyme disease and other tick-borne infections like Bartonella, Babesia, Ehrlichia, Anaplasma, those kind of things. And then, if they turned out positive, which 97% did, I started treating them for the tick-borne disease. So in other words, I started treating for Lyme disease with antibiotics, and hey, they started to get better. So I was kind of, you know, before I knew what was happening, I just was surrounded by the world of Morgellons disease, and I had a lot of patients coming to me because they didn't know where else to go. There really wasn't anybody else to help them, you know, and so I just started trying a lot of different things because I pretty quickly learned that just treating for Lyme disease really didn't do the job in most people. I mean, it made them a little better, but it just wasn't quite doing the trick. And so that's when I just started to experiment with a lot of different things, you know, and different antibiotics and antifungals and antivirals, you name it. As long as it was FDA approved, I would try it because I figured, you know, desperate times call for desperate measures, so let's just see what we can do to help these people get better. That's just, picture me in the old days with dark hair. So, you know, the osteodermatologists and psychiatrists didn't think very highly of me, of course, because they said these people are crazy, they're delusional, I can't even believe you're, you know, treating them as though they have something real. You're sort of buying into their delusion, you know. They said, and whenever I'd argue with them, I'd say, but what about the fibers, and what about the lesions? And they'd say, oh, well, those are self-inflicted. You know, they just gouge at their skin. And I said, but they're in places on the back they can't even reach. And then, you know, I had this patient here who was a model, and then her face ended up looking like that. And that's the last thing she would have done to herself, because she spent lots of money to try to do things to make herself look prettier. And yet she also was being accused of having mutilated her face like that, which seemed pretty absurd. And then I say, well, what about these filaments and fibers that are coming out? And they'd say, well, you know, the patients are sticking those things in there. And it's like, well, that's just so crazy, because first of all, I had tried pulling them out, and I knew it was hard as heck to get them out. You couldn't get them out most of the time. So there's no way somebody could have done that. And plus, I was talking to doctors around the country, and a Chicago gynecologist told me he'd seen the fibers in the cervixes of 2 women on colposcopy. And a San Francisco ophthalmologist had pulled fibers out of the eyes of one of my Morgellons patients. And a Boston gastroenterologist who I spoke with saw the lesions and fibers on colonoscopy in 2 of the Morgellons patients. So he was seeing unusual lesions. He said he had never seen anything like it before, and filaments in the colons of Morgellons patients. So to me, you know, and this is a Richie Shoemaker quote, in the face of obvious abnormalities, skepticism is inappropriate. So the political climate in Texas of treating non-recognized diseases became very hostile. And after a 3-year investigation by my regulatory board, which took about 10 years off my life, I moved out of Texas to San Francisco to practice in the office of Dr. Ray Stricker, who was a known Lyme disease specialist. And so he said I could work in his office. And I spent a couple of years trying to convince him of the reality of Morgellons disease by asking him in the exam room, every time I would see something good, I'd say, interrupt everything, come here, you gotta see this. Because I kept feeling like, you know, if only these doctors would look and see, they wouldn't be able to deny it, you know? I mean, seeing is believing. And the problem was most weren't looking, right? So they weren't seeing. And so and the other reason I called him in too is just kind of for my own, because I have to admit, in the early days when I first started looking at this, there were moments where I'd even say, am I going crazy? Because I was seeing things that you should not see coming out of a human body. You know, when you see a bright turquoise filament coming out of somebody's skin, you're just kind of, well, wait a minute, you know, and I just always felt like I had to have validation of, somebody else come look at this, just make sure I'm not crazy. And so, you know, then he started catching on, and what he saw, he realized it was there and real. And so he got on board and started to treat people too. But I didn't have the ability to show other doctors because they weren't in my office there with them. And that's the only way I thought I could really convince other healthcare practitioners to get on board and believe in this and treat this, is if I actually showed them. Because for some reason they wouldn't go looking themselves. So all this time, since the beginning, since I first started noticing this disease, the main focus of treatment has always been to uncover the burdens to the immune system and work to eliminate those. Because when you have a disease where you don't actually really know the cause of the disease, you can't really go after that. You have to just look at everything else you see and let's take care of all these other burdens to the immune system, so that hopefully we will then, the immune system will be able to recover enough to fight whatever is going on. Because it was very clear to me that a lot of people were becoming infected, let's say, with Morgellons disease, and we're not really getting a very strong case at all. I had some patients with minor cases, couple lesions, couple fibers, they felt fine, all the way to people who were completely disabled. So it was clear that the immune status of the person who got the disease really was a very important part about how sick they were going to be. Now, of course, our immune systems are constantly at work because there's so much always invading our bodies and different bacteria, viruses, toxins, where we're just always working on fighting these things off. But at a certain point, there's just only so much the immune system can take. And so I always think of it as, say, your immune system can say, go up to here with all these different burdens, and then when you get just one too many burden, you cross over what I call the symptomatic line. And once you're there, then all of a sudden you become really sick. And so the goal has always been in treatment to bring you below the symptomatic line, to remove as many burdens to the immune system as possible. So, and because any one of those burdens can become the last straw where you just crash. And many of you probably notice this because so often with my patients, something happened, a big stress, even a car accident, a surgery, death of a loved one, all different things where, boom, all of a sudden, right after that, they started to get really sick. And then they were told by their healthcare provider, well, see, obviously it's psychosomatic because you were upset about that stress, and so this is all psychosomatic, rather than realizing that that stress had been the final straw that tipped them over into becoming symptomatic. And so what I've worked on over the last 16 years is just trying to be a detective and discover all the potential burdens on a person's immune system and working on those to help the patient fall below the symptomatic line. Now, of course, the first one that I immediately realized was the infections with tick-borne diseases. And why did I realize that? Because I was treating tick-borne diseases. So it was kind of, you got a hammer, everything looks like a nail. You know, I would just, that's where I was. I was seeing the world through tick-borne diseases. And since I noticed that, 97% of these patients had Lyme disease or other tick-borne diseases, the logical thing was, let's start treating those. And in fact, it did help with some people, but not all people. So a lot of them had the tick-borne infections, particularly Lyme and Bartonella, but they might also have other bacterial infections, like some had H. pylori, which could cause ulcers and other stomach symptoms. Finding a lot of occult sinus infections too, people who had just these simmering sinus infections that have been going on for years, and not enough to make them just sick as a dog, but just enough to really be suppressing their immune system. A lot of them had reactivated viruses too, like Epstein-Barr virus, cytomegalovirus, and HHV6, HIV, all of those things which were, again, just immune burdens. Systemic yeast is pretty common too, and that's another thing that I found in a lot of these patients, as well as intestinal helminthic parasites, which means basically worms. And most people who have worms have no idea they have them because they adhere tightly to the intestinal wall, so they're not coming out. When you look at your bowel movement in the toilet, it's not, you're not seeing them usually. And so usually also the test, if you have a stool test, they'll come out negative because they're not coming out with a stool. And so that's another one that people often have and don't realize they have. Also, any of these people who were taking immune suppressant medication, those were my sickest cases. The people with autoimmune disease who were on immune suppression, people with severe allergies or asthma usually are on immune suppression. And I've had a number of organ transplant patients. And of course, those people are on very severe immune suppression, so their body won't reject the transplanted organ. And probably the worst cases I ever saw of Morgellons were in these organ transplant patients who were on severe immunosuppression. And then, would also find things like hormonal imbalances, either thyroid problems or the female and male hormones. And then just a lot of lifestyle things too, because your immune system can be deeply impacted by overconsumption of alcohol, by smoking tobacco, by not enough sleep, by poor nutrition, like pro-inflammatory foods, like eating a lot of sugar and processed food, A lot of people have food allergies and they don't even know it because it's something they have every day, so their symptoms are masked, and they may be allergic to wheat, but they consume it every day, so they don't really know. And just not getting enough vegetables, also contaminated food that we might get. My patients would have specific vitamin deficiencies, and dysbiosis just mainly means, everything in the gut not working right, and therefore the food not being absorbed properly, so, just poor nutrition. So, all of these things, and then there's the environmental things too that have become very important thing to look at. And so we have the heavy metals. Sometimes people have that as one of their burdens. And then the airborne toxins too, like pollution, secondhand tobacco smoke, insecticides, and I highlighted here mold because it's a biggie. We'll get to that later, but it has become a huge, huge part of the treatment of Morgellons patients. And the biggies too, last but not least, stress, emotional stress and physical stress. So I'm just going to say this for an example here, and don't take it too literally, but just kind of to give you an idea. Let's say your immune system can deal with 5 of those burdens that I just gave you before you cross the symptomatic line. In other words, before you just give in and crash. So let's say you already have 5 immune burdens. Let's say you have severe life stress, you're smoking cigarettes, you're eating an unhealthy diet, you have this unknown Lyme infection that you've had since you were a kid and you don't even know you have it. Then you move into a moldy apartment. I hear this story so many times. That's why I use this example. You move into a moldy apartment and boom, all of a sudden you crash. That becomes the last straw and you become symptomatic and you become very sick. And a lot of my Morgellons patients associate the beginning of their symptoms with that. Now, a lot of them will say to me, so are you telling me mold causes Morgellons? No, absolutely not. I'm not saying mold causes Morgellons any more than I say Lyme causes Morgellons. We don't know yet what causes Morgellons, but we do know things that are highly associated with it. In other words, a huge percentage of these patients have these certain problems. So sometimes just removing 1 or 2, immune burdens can be enough to put a person below the symptomatic line. Now, of course, like I said, the first thing I noticed in the 97% of my patients having Lyme or other tick-borne diseases, so that was the obvious thing to work on first. And primarily, that's been the mainstay of what I've been doing all these years in trying to get patients well, is working on those underlying infections. So I've been treating patients with combination of antibiotics, and through the years I have found that an antibiotic protocol that particularly targets a Bartonella infection works the best at Morgellons. If I just treat strictly for Lyme without throwing in the Bartonella treatment, get a little improvement, but just don't quite get there. And over time I've found that about 90% get better. In other words, 10% really completely cured, don't have one symptom left. But the majority of the people I've treated are, I would say, 95% better. They still have a couple of little symptoms, maybe a few little lesions, a few fibers, but not enough to disrupt their ability to carry on and lead a normal life. So that's kind of the realistic statistics here. And then about 10% really don't respond very well to treatment, but these people do have a significant amount of other immune burdens that, and also those people that don't respond usually have been sick for a very long time. Because I do get people in my office who've already had Morgellons for 30 years before they come in, and man, it's really hard to treat those people. They'll get a little better, but to get those people who've had it for 30 years totally asymptomatic is honestly, pretty difficult. So So mold came into the picture, and I've known for years about the work of Dr. Richard Shoemaker, who found a very strong association between Lyme and mold toxicity. Basically, it's kind of a 1 + 1 = 3 situation, where if you have a patient who has Lyme and a patient who has mold toxicity, both are just made worse. When you combine those two things, you're really looking at a very, very sick patient. So for me, my second biggest breakthrough in treating Morgellons disease since finding and treating Lyme and co-infections has been the mold part of the picture. Now, 24% of the general population has a genetic haplotype that makes them extra sensitive to mold. And so these are the people, when they enter a moldy building, and I'm sure you all either know people like this or you are people like this, they're highly sensitive to it, and they get a headache quickly, and they just know there's mold in the building. And whereas 3 out of 4 people, they could just live in the moldy place, doesn't bother them one bit. Now this 24%, the problem is they can't transform mold and other toxins from a fat-based form to a water-based form so that they can eliminate the toxins. So their problem more is with elimination of mold toxins. The interesting thing is, although 24% of the population has this genetic haplotype, 100% of my Morgellons patients have it. So basically, what you're looking at here is people who are hypersensitive to mold toxicity are going to be more susceptible to getting Morgellons disease. Am I saying mold causes Morgellons disease? No, not at all. I'm just saying that once again, we're seeing a strong correlation with something, just, like we did with the Lyme disease. So once I started realizing that everybody had this haplotype, I started to realize how important that part of the picture was in getting people well. So if you want to find out if you have this genetic tendency, it's a blood test through LabCorp, but your doctor will have to order it. But here's the test number and what it's called there. Your doctor will have no idea how to interpret it. And so if you get the results back, send me an email, and I will send you a little simple calculator thing to help you figure it out. So if you're interested. I have to warn you up front, though, this test is about $700, and if you don't have insurance, it's not a cheap test. So, okay, so anyway, once you find out somebody has the tendency toward this hypersensitivity, the next thing is you want to do a urine mycotoxin test. In other words, see if the person is actually spilling fungal yeast kind of toxins in the urine. And Real Time Labs does this, Great Plains Laboratory, and these again do have to be ordered by a doctor. And there are some, they give you some challenges to do first before you do these tests, because since the mold toxins are sequestered deep in the cells, they're not going to readily release into the urine when you do the test. So there are some things you can do to help them come out. And those instructions come with those lab tests. So now, second step, we found out you are a mold sensitive person and you have mold toxins coming out in your urine. Well, the most important thing we need to know right now is, are you currently exposed, or is this from a previous exposure? Because you could be living in a bubble now, and if you are a mold sensitive person with mold in your urine, you may just have it from a previous exposure, because since you can't let go of those toxins, they're still in there. So that's why it's so important to have your home tested. And I tell you what, I am just seeing with my Morgellons patients, I mean, a huge amount of them are living with mold. And we're just fighting a losing battle and going with the antibiotics if that is not dealt with. Now, easier said than done, because, if you find out your home is moldy, geez, I mean, what are you going to do then? If you own the home and you're already sick, you don't feel like doing everything that it takes to have to sell your house, remediate. It just opens a can of worms, really, you know, when you find it out. But it's an important thing to find out, because otherwise, these are the people that you just keep treating and treating and treating, and they're just not really getting better. And then come to find out, hello, they're just exposing themselves to a huge immune burden every day, living in their own house. And some of these people are actually getting it through their workplace too. That's another important thing. Now, you can test in your own home through mycometrics. You can order their dust cloths, and this is something you can do without a doctor. And they'll give you your what's called an ERMI score. And if you're a mold-sensitive person spilling mold toxins, that score should be 2.0 or below. Most people that are testing are coming out quite a bit higher than that, you know, with my patients that are doing this test. Now, people do have specific symptoms of mold toxicity, like headaches, coughing, nasal congestion, itchy skin, nosebleeds, depression, anxiety, sore throats, itchy red eyes. But those are kind of the specific symptoms of mold toxicity, not even getting into talking about how the mold is so immune suppressive. You know, so that's probably the biggest issue right there. And so if you do find out that this is a part of the picture for you, a part of your illness picture, of course, the number one thing is to remove yourself from the source. And that's the hardest part, though, you know. But I have written letters if patients are renting an apartment and the apartment is moldy. I write them a letter to help them get out of their lease early. But when they own, it's a little more difficult. And you have to not take with you any of the porous items from the moldy environment. That's another hard one, because, you know, that means all of your furniture that's not wood you can clean down, but any of the stuffed furniture and that kind of thing. So that's hard too. And then I have people detox. The detoxing is actually fairly simple in a way, in the sense that it's all over-the-counter stuff that you can use. It's not prescription for any of the detox. You can get oral glutathione. Of course, some people can even get intravenous, which is good. Alpha lipoic acid. I find this particular one to be the very best. Calcium D-glucarate and chlorophyll complex, and then using far infrared sauna. So all these things are helpful to detox from mold. And then we also use some binders, like activated charcoal is really good for mold. And zeolite is the one that I'm starting to use more, because it's really well tolerated. You will hear about cholestyramine. That's a prescription, or well call. And those are the ones Dr. Richard Shoemaker used. But you don't really have to go with those prescription ones. There's several other ones that are just as good that you can get yourself without a prescription. The most important thing when you're detoxing from mold, it's very similar to when you start antibiotics. You know how for most patients, when we start treating them for tick-borne disease with antibiotics, oh my gosh, they have a huge Herxheimer reaction. In other words, their symptoms get way worse before they get better. And even Cindy Casey was just talking about that herself, how when she started treatment for the whole first year, she felt way worse. And that happens sometimes. Sometimes people can have a Herxheimer or feel worse for a very long time. Same thing happens when we detox people from mold. They have very strong reactions as we start to release those toxins. And so I have people start one product at a time, tiny amount, just gradually work up, and then they can tolerate it. And after about a year, we recheck the urine tests to see if there's no more mold coming out. So basically, what I've been summarizing here is just different factors that could be standing in your way of healing. And these are things that you can address even before seeing a doctor, because I know that many of you out here who are patients, it's not very easy for you to see somebody who knows about Morgellons for one reason or another. I mean, there's very few of us that do it, and we're far away, and it's expensive, it's difficult. So there's things that you can do, though, to start lowering your immune burden so that you would have a better chance of getting better on antibiotics. I actually have had a few Morgellons patients that once we worked on removing some of these immune burdens, they didn't even need antibiotics. So that's another thing. So just as a review on the factors that could be suppressing your immune system, just quickly, is the infections that you don't know about. You know, these could be tick-borne infections or other bacterial infections that you have in your sinuses, in your stomach. Viral infections, yeast, intestinal worms. These are all things that you may have right now and not even know that you have. It's very common that people don't. You do know if you're taking immunosuppressants, so that's kind of something that can't really do a lot about if you need those to survive. Looking into hormonal imbalances can help the whole situation. Of course, the alcohol, tobacco, poor nutrition, lack of sleep, those are all sort of lifestyle things and things that can be changed, but I admit, very difficult to do that. And then we're also concerned with metal toxicity, pollution, secondhand smoke, and of course the mold, and last but not least, the stress, emotional, physical stress like trauma, surgery. Can't do too much about that. So these are some ideas of what you can do now on your own. In other words, you do not need to have a doctor for these things. What you can do, and sorry about this, Jyotsna. Jyotsna, lovely Dr. Shaw is here from IGeneX, and I still think IGeneX is the best place to test, but DNA Connections, you can order it without a doctor. So if you're living out somewhere and you don't have a doctor anywhere, you can order through DNAconnections.com. It is a urine kit, so you don't have to worry about who's going to draw your blood. And you can do it at home, and then they'll test for 11 tick-borne infections for $650. And I have found this to be, you know, quite good. I mean, nobody's as good as IGeneX, but, you know, I mean, this way you can, it's something you can do on your own. And I know, you know, like I say, if you haven't been able to have a doctor help you yet, a lot of times being able to be proactive and get started on some of these things is a good thing to do. So this has been helpful. And then there are simple at-home tests, self-tests for intestinal worms that I have people do. It's kind of a challenge. I just have them take the herb, wormwood, for 3 weeks. And you can get this at different herbal stores or anything. And what the wormwood does is it actually kills some of these parasites so that they come out and you can see them. Well, there's no better diagnosis than that because there they are. And so this is kind of a treatment to diagnose. However, it's not effective enough treatment, so if we do see something coming out in your stool, the next step would be to more intense treatment for those worms. But this is kind of a way to self-diagnose, to see if you have anything. And a lot of my patients are shocked to find out they do. Had no idea. You know, when they start taking this and they actually see, you know, worms coming out, and it's kind of a freaky thing, but you do want to know about it because, of course, it's suppressing your immune system. And then you can do a self-ordered test for metal toxicity through Thorne. $165. You not only get the results, but you get the treatment suggestions from them too. And this was at thorne.com. So even if you don't have time to write down that entire specific, I think if you just went to thorne.com and put in heavy metals test, you would be able to find that. And you know, other things that you can do, again, I know these are not easy, but stopping smoking is a big one. And I actually, as of a few years ago, I do not accept patients that smoke anymore. And that is because it's such a huge immune burden that I feel like, you know, why are we doing this? We're working at cross purposes. And so I have people quit smoking before they ever even come to see me, because I feel like that's just a huge part of this. And then the other thing, I've had people feel 50% better just by changing their diet. I mean, it's hard for me to convince patients of that, but when they do it, they're like, hey, you were right. And if they stop having sugar and wheat and processed foods and oils, within 2 or 3 weeks, they just feel so much better. And it just reduces their inflammation. And then also food allergies, you know, doing an elimination diet for that. What you do for 3 weeks, you avoid all the most common food allergens, and that's very easy to find online. These are things like corn and wheat and peanuts and strawberries, and you know, you'll leave out about maybe 12 foods. Not hard at all to leave them out. You leave them out, and then one at a time, you start to have them again. And because you've been off of them, you'll have a more extreme reaction. And so I was shocked to find out when I did this that I was allergic to tomatoes. I never realized it, but after not being on them and then having one, I instantly got a very runny nose. And so you won't get that symptom unless you're off of it for a while and reintroduce it. And then, in regard to the mole, investigate your home well, especially if you've had, you've had any leaks. You can order the AccuCloth kit from Mycometrics. That's another thing you can do without a doctor's order. It's going to be a big, big decision, though, about moving versus remediation and detoxing. This whole mold part of the picture is a real pain in the neck, but it just has to be talked about because it is huge. And it's just, as more time goes on, the mold part of the picture, I realize now, is every bit as important as the Lyme and tick-borne disease part of the picture in getting Morgellons patients well. So, and just to sum up here, too many burdens on your immune system can make you cross over that symptomatic line. And so try, even yourself, before you get to see a doctor, you can try to identify and remove as many burdens as you can to see if you can get yourself better. And I've had some patients, I have to admit, they're my Morgellons patients with maybe not the most severe cases. By doing this, we don't have to treat them with antibiotics. They're able to feel better just by doing some mold detox and changing their diet and a few other things like that. So, but anyway, even before, if you're thinking about seeing a doctor to treat your Morgellons, you would do well to do as many of these things up front because it's going to make your immune system stronger and more able to work at fighting this thing that we're dealing with here. I'm not a researcher. I didn't plan to talk to you anything about the research that's going on with this today. I'm a clinician. And so for me, all along this thing has been about how can I help people feel better? That's what I do, I've got other people, luckily, that are in the laboratory and doing that. But mine has always been, how can we get these people to feel better? Because they're, as you know, pretty miserable. And so these are just the things I've discovered through the 16 years of treating so many Morgellons patients. And I hope that, some of this will be helpful for you in your journey to getting well too. Thanks.